This video will demonstrate the Glasgow Royal Infirmary pin site dressing protocol, which is supported by the Royal College of Nursing Pin Site Care Guidelines 2010. Pin site dressings should be changed every 7 days, and this is commonly carried out after the patient has had a shower. It is important to mention that the pin site dressings should be removed before having a shower. What is needed for the pin site dressings? Well, firstly, you will need a dressing pack. You will need a bottle of cleaning solution, which is a chlorhexidine-based solution, and you will need packets of sterile woven swabs. I recommend using 1 swab for every 2 pins. These come in packets of 5. You will also require gloves. These items will be provided by your healthcare professional. When carrying out the pin site dressing procedure, we would always ask you to wash your hands with soap and water. Once you have done this, you will open up the dressing pack. Inside the pack, you will find 10 soft, fluffy swabs, a plastic tray to hold the solution, a paper drape that will be underneath your frame, and a small plastic bag that will be used as a bin. You will need to open up the required number of packets of woven swabs onto the dressing pack. At this stage, we would ask you to pour some of the cleaning solution into the plastic tray. You should now put on your gloves and place the paper drape underneath the frame. We are now ready to begin the cleaning procedure. Firstly, we will clean the pin sites themselves. We will be using the soft, fluffy swabs for cleaning. Take a swab and dip it into the cleaning solution. Squeeze any excess fluid from the swab and open the swab out and place onto the open dressing pack. At this stage, it is usually preferable to prepare all your cleaning swabs in advance. Take a swab and wrap around 2 pins. Gently wipe the skin around each pin site and then wipe up and down the wire itself. Dispose of the swab into the plastic bag. Take a fresh swab for the next pair of pins and work your way down the frame until all the pin sites have been cleaned. Once all the pin sites have been cleaned, we are now ready to apply the dressings. At this point, we will be using the woven swabs. These swabs are used for the dressing as they allow the cleaning solution to evaporate. It is the evaporation of the solution that provides the antibacterial action. These swabs are also non-shedding and will not leave any material on the wound when removing. The woven swab should be dipped into the cleaning solution and gently squeezed to remove any excess fluid. The swab should then be opened as shown. It will now be folded lengthways as demonstrated. The pins will be dressed in pairs, similar to the cleaning process. The swab should then be placed onto the first pin site, with the wire sitting halfway along the swab. Taking the first half of the swab, you should wrap the swab around the pins using a figure of 8 pattern. Once you have done this, the remaining half of the swab should then be wrapped around the outside of the 2 pins. you can tuck the end of the swab underneath. The plastic clip should then be slid down the wire gently. There should only be enough pressure to stop the swab from unravelling. Too much pressure can lead to pressure sores. This process should be repeated until all the pin sites are dressed. Sometimes there are an odd number of wires. For example, if there is a thicker half pin. These may be dressed individually by wrapping a single swab around the pin and securing with the plastic clip. Once you have dressed all the pin sites, you should place the dressing pack and any remaining swabs in the plastic bag. You should remove your gloves and place these in the plastic bag also. The bag should then be disposed of in your own household bin. It is advisable to wash your hands again. Thank you for watching. If you have any questions, please contact me.